right, welcome to Rebel headquarters on a day that Bernie Sanders held a town hall event. We broadcasted along with Now This and Attention. Anna was one of the hosts of the event, and now we want to talk about it a little bit. Our first set of guests are Katie Robbins and Kim Behrens. They set up watch parties for Bernie Sanders town hall events. Katie is the director of Campaign for New York Health, and Kim is the member of New York State Nurse Association. Welcome to Rebel headquarters. How are you?
Hey, it's great to be here, Cenk. Thanks for having us.
All right, no problem. And they're in our Washington office there. So first of all, a fun question. Just you just watched it. So how is the Medicare for All town hall? Did it live up to your expectations?
Well, I would say it's about time we had this national conversation. I'm so grateful to Senator Sanders and outlets like yours who brought this to hundreds of thousands, millions of people tonight, making the case for Medicare for All when unfortunately the mainstream cable networks have not been able to step up to the plate and do the job. So I'm thrilled that this conversation happened on the national level. And I think incredibly salient points were made by their expert panel. Kim, do you have anything to add?
I would add the same thing. One of the things I want to thank you for is actually asking a nurse, someone who's actually on the front lines of dealing with the patients that are affected by our current healthcare system. And so all of these political pundits and all the healthcare policymakers and all the people who talk about healthcare and how broken it is are never in direct contact with the patient. So I actually have a firsthand knowledge and experience with the people going through these issues.
All right, great. And so tell me about the watch parties a little bit. How did people sign up for it, and how did it go across the country?
Well, my area is in New York State, and we had people all over the state. You know, we have a truly statewide movement for Medicare for All. We actually have a state bill that we advocate for in New York. We've passed our bill through the Assembly several times and have almost a majority of the Senate in support. So there's active chapters of our campaign all over who tapped into this opportunity to hear the case for Medicare for All. And we really linked the connection that our work in New York State is going to inspire people all over the country to follow our model if indeed New York is able to pass a Medicare for All system on the state level. So it was really exciting to have people sign up and invite their friends over to hear this national discussion take place for the first time. I mean, history really was made with this.
Kim, the nurses now all of a sudden in the last couple of years appear to be the most active union, the hardest fighting progressives in the country. What happened? How did the nurses all of a sudden become the progressive champions of the world?
Well, I think it's not a new phenomenon. In fact, part of the ANA Code of Nursing Conduct and Ethic is we have to advocate for the patients that we take care of. And healthcare justice and single-payer healthcare movement is right in, is congruent with our philosophies. So for us, we're really busy, but we have the direct contact with our patients. So we do know firsthand when someone comes in without adequate insurance or with insurance, but can't afford the co-payments or all the other hurdles that they have to face. Our job is to advocate for them, and best way of advocating for them is being active and participating in the movement and to change the existing system.
So I wanted to ask both of you guys if you have personal experience with our current system and some of the failings of it that personally motivates you to be in favor of Medicare for All.
Well, I can talk about myself, but more I can talk about the people that I encounter every day. I worked last night and the day before, and I actually had a patient who came in, and he was really skinny guy. He had only just skin on his bones, and he's like around 65 years old. He came in, and I said, "So what's going on, sir? Are you eating well? Are you okay? Are you able to eat? Maybe he had some sort of issues swallowing." He goes, "No, look at me." And he opened his mouth, and I go, "He had no teeth. This guy hasn't had teeth for the last 5 years, and he has no access to dental care." And he said, "I can't eat anything. I can only eat soft foods." But because he's homeless, he has no means of preparing his food. So this guy has been slowly deteriorating away and not having teeth. That's, that's outrageous. And then I had a patient not too long ago who decided that she had to leave the United States. She said, listen, I'm going back to Hungary, where I'm from. I've lived here for many years in the US. She was diagnosed with cancer. She couldn't maintain the job she had, which covered her insurance, but because she wasn't working, she lost her insurance. And finally she said, I have to give up. I mean, I can't maintain living in the US anymore. At least if I go back to Hungary, they have a healthcare system that I can rely on.
Yeah, it's funny. There's so many similar stories. The first doctor that Bernie Sanders talked to in the town hall talked about how they do these kind of a clinic, I guess, where they give away health care for people who don't have access to it here in America. I mean, it sounds like the kind of thing that you hear in a refugee camp, but we do it for our own citizens because we don't have universal coverage. So he said the main thing people came for was for the dentist. We have this crazy system where your teeth is removed from the rest of your body when it comes to insurance. And teeth are monumentally important, right? The worst pain I ever had in my life was a toothache. And if you have a problem with your teeth, it is urgent, right? And a lot of times people aren't covered for that. I have got family members from Taiwan, my wife is from there, that sometimes they just like your story from Hungary, they're going back to Taiwan to get healthcare. They had to move to get healthcare out of the country. So what the politicians tell you about, everybody's coming to America for treatment. No, it's the exact opposite.
Absolutely not, absolutely not.
Right, absolute medical tourism. I mean, myself, I got involved with this work a number of years ago when I graduated from university. I worked in social services in rural Ohio. I worked at the domestic violence shelter, actually, and encountered a number of families who would return to unsafe homes because they needed to stay on their abuser's health insurance plan because they needed to keep that insurance for maintaining chronic conditions and accessing medications for themselves and their kids. So this system is not just about how expensive it is, but we have a healthcare system that ties it to jobs and marriage, which really dictates people's life choices. I actually ended up getting married to my husband to make sure he could get on my health insurance plan at the time. And unfortunately, some folks stay in marriages that they shouldn't because of insurance issues. So it's really a quality of life issue in addition to the economic aspects of it, right? And I think a number of those points were made tonight in a really compelling way, particularly around the challenges of an employer-based system. We really need one that is not tied to any means testing. We need a healthcare system that is based on the fact that you're a human, you're here, you need healthcare, and it's going to be available to you without financial barriers. More of a public good.
Yeah, so again, in the town hall, there were a couple of moments that I thought were really interesting in that regard. One, they talked about people having to stay in jobs they don't like because otherwise they're not going to have insurance. And I told a story just before we got to Rebel headquarters as we were doing part of the coverage about I knew a fairly high-paid executive at MSNBC who had to come out of retirement, go back to work because his wife got sick, and they weren't 65 yet. It's such a crazy system that we have to wait till we're 65 to get decent health care and to get relief. And that word relief kept going through my head as I was listening to the town hall. In the other countries, the other developed countries where they have some form of single payer, they just have enormous psychic relief that they're not going to get bankrupted, that they can get any job they want instead of the job they have to get for insurance. They can don't have to worry about, there goes my deductible. I mean, it goes on and on and on. And then one more thing about that. There was a business owner on who said, he calculated the cost and it's $13.50 per hour, which is higher than the minimum wage in most of the parts of the country, for just healthcare costs for his employees. And then the other business person said, and if the business next door that I'm competing with decides that they don't care about their employees, they just don't provide it, and then the taxpayers have to pay for it. We get it, Medicaid covers it, right? So that hurts our competitiveness. It costs so much more money, and we have a vicious system that lets people die. If it wasn't, I mean, I know the answer to this, but you guys work on it every day. If it wasn't for the money in politics, would any of this ever stand in a real democracy?
I think it's more than money in politics. There's the way our current system is operating under an insurance-based for-profit model is inherently geared towards failing the people who need the actual health care. Let me cite an example. We have massive corporate welfare system where big pharmaceutical companies could be based outside the United States. They share or they profit from the being, having a market share of the American economy and selling it at exorbitant high prices, but don't pay the taxes because they have an office in Ireland, right? But they can charge twice, 3 times more than any other countries pay for their medications. So we subsidize the corporations and they're allowed to get away with it. That itself, to me, is a crime. And the policymakers are just as wrapped up in this form of, system that we were, under.
I also think one of our challenges is education. There's really been many years of propaganda put out by insurance companies and pharmaceutical companies claiming that healthcare in other countries is deplorable and that we have things to fear from the idea of a national health insurance program. But what happened tonight is that we started the conversation. We got facts to the American people. We recognize that once people understand it, it's incredibly popular. And so I think that we're really building the kind of movement that needs to take on the powerful interests that have controlled this debate for so long. And so I'm really grateful for everyone who made the event happen tonight to get the ball rolling on that.
Yeah, most especially, of course, Senator Sanders. Katie, I actually had one more question for you, and just to back up the points you guys were making, Bernie Sanders pointed out tonight that the 5 largest pharmaceutical companies made $50 billion in profits last year. So it's one thing if you earn it in a free market, it's another thing if you capture the government and create monopolies for yourself and create this perverted system where you profit off of our losses. And so those are the issues we have to fix. But Katie, the question I had for you was, you're fighting on a state level for universal health care. So just tell us a little bit more about that, because I haven't heard much about that before, and I want to make sure the audience hears about it.
Sure. Well, currently over 20 states have state single-payer legislation. California and New York have had a lot of momentum on the state level. In New York, we actually have passed our bill that would create a universal single-payer system for all New York residents 3 times in the assembly. We had, at the end of last session, we had 31 Senate co-sponsors. You actually need 32 votes to pass the bill in the state Senate. So we're really building up a lot of momentum. Now, if you follow New York politics, you know that currently Republicans are in control in the state Senate and have not, unfortunately, we don't have any Republican co-sponsors yet. We are working on that. But essentially, in this era when especially there's so much fear from policies coming out of Washington that are going to cut funding for healthcare programs and potentially dismantle the ACA, that people are really afraid. And New Yorkers want a dedicated universal program to make sure that they're protected no matter what Washington does. And the thing that's important to remember is that because in the country and also on the state level, we spend so much on healthcare that we actually don't have to spend any more money to make sure that we have a universal, high-quality healthcare system for every resident in New York State. Now, we really hope that New York helps to set the trend. Other states will follow, and we hope that shortly the entire country will have such a system. But we think that it could be an example that other states in the country can learn from. In Canada, they passed it province by province. And we believe this is good policy and also good politics. In Canada, the father of Canadian Medicare, Tommy Douglas, is voted most popular Canadian year after year, and he's been dead for a while. People love the Canadian Medicare system. And that political legacy is on the table in New York State and in the country right now.
Well, it is refreshing to hear about a country whose biggest hero is not someone that was involved in a war, but that actually saved people's lives. That is good to hear. So thank you so much for being on. I think that I certainly would like to have more conversations on this program on Rebel Headquarters about how to do it state by state and how Canada did it in the way that you're describing. So hopefully we'll have you guys back on at some point to talk about those extra issues as we sort all this out. So Katie Robbins and Kim Behrens, thank you so much for joining us. Really appreciate it.